And after all that, I'm happy to report Susan Koppen is here with us today. Susan, come on out. How are you?
I'm great. Oh,
You look fabulous.
thank you. Thank
Come on
you.
over. If you go back to that day, do you remember the moment?
No, I don't remember any of that. I had no pain. I had no fear, and my world just went black. I was gone.
And that's very common. So you had no prodromal symptoms?
No, and I had a cold, and but it wasn't anything severe. And that morning, we were training for a half marathon, so that's why we were going out that day. And when I got to the door to leave, my 5-year-old daughter said, "Mommy, don't go today. Don't run today. Don't go today." And I said, "I'll be right back. I'm going for a quick run. I'll be right back." And I gave her a hug, and I didn't come back. I didn't come back for a couple weeks.
And you had what is overall considered to be a relatively benign condition called mitral valve prolapse.
Right.
Benign in the sense that in most people it doesn't cause any major problems. But your case is so interesting because Dr. Magliato, I mean, this is, to think of mitral valve prolapse as potentially leading someone into cardiac arrest, not common.
You're right. There isn't a really clear association, Travis, between mitral valve prolapse and sudden cardiac death. In fact, the evidence is really sketchy. I think we ought to be really clear about that because I don't want people to think, oh, I have mitral valve prolapse, I'm going to have what Susan had, I'm going to have sudden cardiac death.
And let me show people at home what we are talking about, both when we talk about a heart attack and quote-unquote cardiac arrest, because normally, as you go about your daily life, your heart is constantly beating at a nice normal rate. Everything, all the electrical signals are nice and in synchrony. Now, what can happen in the case of a heart attack, you can actually get plaque buildup in an artery that supplies blood flow to your heart. When that plaque ruptures, it stops blood flow to certain areas of your heart, and when that occurs, your heart muscle beyond that blockage will die. So that's a heart attack. After a heart attack, or if you have known structural damage to your heart, occasionally, when the heart's normally beating, it's fine, but occasionally your heart will actually go into something called ventricular fibrillation or some other arrhythmia. And when that occurs, instead of a nice synchronous pattern of beating, your heart will literally start to fibrillate. And we call that ventricular fibrillation. What's going on is when your heart's quivering like that, you're not getting any blood flow to your brain. So you are essentially in cardiac arrest. The only way in many cases to get you out of ventricular fibrillation, I'm going to show everyone something that saves lives, something that I think may have saved your life.
Yes, indeed.
This little red box, this little defibrillator, this is what's used to shock your heart back into a normal rhythm. And you were the beneficiary of CPR at the scene, right?
Right, yeah. Also, the firefighters who had an AED were right around the corner. They were there in 4 minutes and shocked my heart.
Well, you're a living, breathing miracle. We're so lucky to have you with us today.